Hi, everyone. Happy Friday from Toronto. Dr. Amin here. Another beautiful day. And we're going live today to talk about something very, very important in midlife um, that is commonly we see it's ignored, whispered, overlooked. And that is the sexuality in midlife. And this is something that I commonly see in my practice, in my clinic. And I have invited a psychologist and a therapist, couple therapist, sex therapist, Dr. Arielle, today to see how she works with couples and how she helps them during this difficult time. So I'm going to invite Dr. Arielle in a second. And if you have any questions um, about anything in midlife, all the changes, especially related to sex drive, sexuality in midlife, do not hesitate to drop it in the comment or the question bubble. And we're going hopefully through it. We have half an hour time. So let me invite Dr. Arielle quickly and hello.
Hi.
Hi. Lovely to have you here. Finally, we made it.
We did. We did. Thank you so much for having me.
It's good to have you. And we're going to talk about a very, very important topic today. I was just telling to everyone here today about sexuality in midlife, something that is ignored or overlooked. It's still a taboo, at least the way I see my patients every day. This is the last thing they bring up. Probably they won't. I have to ask directly the question if how they feel, how midlife with their sexuality, the confidence, how they feel. So I think this is something that is still quite a bit of place to work on.
For sure, for sure. I think we need more
So
education and we need to
if
talk about it.
you talk a little bit about yourself, what do you do first of all?
Yeah, so I'm a psychologist and let me
Yeah, it's okay. I think you're back. You're
perfect. Yeah, so I've always focused on sex and couples therapy. That's always been all my training, all my clients, that's what we focus on. So I mean, for me, talking about sex is normal, right? But in that, I focused on various things, and what I primarily focus on is helping clients and couples really to navigate the period from first starting to look at having kids, like starting their families, fertility and more, and then going all the way through. So pregnancy, postpartum, but even all the way at the opposite side, right? Of kids, having kids, what that the impact is on your couple relationship. And as you grow older and as you navigate having kids and parenthood and they're leaving the nest, right? So they're older. What does that look like? What is the impact on your couple? What is the impact on your health? In terms of, menopause, if you're going even through perimenopause and beyond, what does that look like for you and for your partner as you're navigating this together?
great. It's certainly a very challenging and difficult. As I was saying in my practice, I deal with a lot of women going through the change in their perimenopause with hormonal imbalances and shifts. So what I see is someone who have less libido or sex drive. Could be it is very multifactorial what I see, very complex. It could be different factors involved. So one is a lack of sex drive and libido, physical challenges, pain and discomfort, and then the sexual confidence and the physical image changes, mood aspect. So all of those hand in hand, and then of course in certain cases we have relationship problems. So there's so many different elements here, which makes it more challenging and complex. From my point of view, again, I try to balance hormones a lot. We see a significant sharp decline in estrogen, which I call queen of hormones, with all the feminine aspects, with the lubrication that we have, then vaginal atrophy and thinning of the wall of the vagina, pain, discomfort, as well as, again, affecting mood, sleep, and skin even. So all of those impact their confidence. So that's with estrogen. We have decline in testosterone, progesterone. All of them have very important and significant roles in different parts of sexuality. And love hormone, the oxytocin. So I try to balance and help to replace these hormones to help them physically, mentally, with the energy level and sleep. But I would love to hear your the way you work with with the couples and clients.
For sure. So it's a bit of everything that you mentioned right there, right? In
Mhm.
terms of, when someone comes to my office, we're looking at everything, right? We're
Mhm.
looking at the biopsychosocial model, meaning we're looking at biological factors, where you're at in terms of everything you just mentioned, hormones, where your cycle is at, where are you in terms of age, where are you in terms of physical health, right? Is there anything else that's impacting your physical health? Then we're also looking at the psychological factors, right? So, you know, I think also in terms of narrowing down what are we looking at, people think, oh, midlife, okay, that's, we have this vision of this is really old, and how did we get here, etc. But I think we need to normalize that we're talking about starting in our 40s, right? Which is not so far off. And it's not, um, you know, greatly different in terms of a huge shift from your 30s, but it also is in terms of psychologically, right? In terms of psychologically speaking, you're coming from your 30s, you were maybe focused on your career, you were maybe focused on getting that relationship, going into a long term relationship, and focused on, if you wanted to start a family, right? And so we're focused on fertility. We're focused on, okay, well, we have enough time to make it until we're 40, 45, right? Until, that piece is talked about and dealt with. Forget what happens afterwards.
Mhm.
And
Yeah.
also, I think, a lot of people, or a lot of women I'll speak about, feel confident in their 30s, right? As
Mhm.
in your teenage years, angst, your 20s is a time of discovery and a time of understanding, what's happening, how do I function in relationships, how do I start a relationship, what is dating, what is casual sex, all those kinds of things. And then you get to your 30s and you're like, oh, okay, I'm starting to get this. Right? I'm starting to figure out who I am. I'm starting to figure out what I love, what I don't like, who my relationship, who my partner is. We're starting a life together. We're building something together, right? We're building our careers. We're getting there. And then you're getting into your 40s and your 50s and beyond, and things are starting to change again, right? In terms of your health, in terms of your sexual health, your hormones, your life, your kids, stress, etc. It's all changing, right? And I think it's just a little bit debilitating in confidence and in terms of body image and in terms of your relationship itself, right? All those things have an impact. So when you're coming into my office, we're looking at all of those things, right? We're looking at it individually in terms of what is the impact on you, and we're looking at it in your relationship in terms of the couple and how each of you impact each of you, right? And what is playing out in your dynamic.
Mhm. Interesting. So do you normally see couples together or individually, or both?
Yeah, so I mean, I think every couples therapist does it a little bit differently. In terms of my brand of therapy, I always see the couple together and
Mhm.
only together. I just think it brings so much um, richness in terms of for them to hear perspective, is talking about the assessment and looking at what are those biopsychosocial factors that are happening in each of their lives. It actually brings so much richness for each of the partners to listen to this and to actually understand the other person's perspective, right? And when someone else is doing the asking, it's different, especially for those couples who've been together for 20 some years, right? At that point, they might not have asked each other these things in a very long time, right?
Exactly. And there's sometimes you asking some questions that probably they never thought about it. So it's interesting to see at the same time how they process the question and what's the answer.
1,000%. And I find it helps to build empathy, even just from the first few sessions of walking in my door, but of hearing each other out, understanding what's going on, hearing your partner talk about it from a distance than the one you're bringing. I think that really helps couples to connect right then and there.
Mhm.
And so
Definitely.
that's, you know, my reasoning as to why I always keep my couples together. I think it just adds connection, which is what they're coming to my office for.
Mhm. Mhm. What I sometimes hear from patients, from women, that is my more center of focus, is that I don't feel sexy anymore. I don't feel myself even. So that commonly I hear, and they just normalize sometimes. They say it's just I'm tired and I don't have time. This is the last thing in my agenda. And then there's the unhappy other side, the other half of the husband or partner who's very unhappy, and that kind of escalates everything.
Yeah, 100%. And I think, right, in terms of, I think a lot of couples do come in because there's a mismatch there, right? In terms of a mismatch of maybe libidos or in terms of connection, as to one wants more connection, maybe one wants more physical connection, the other one wants more emotional connection. Um, there's a lot of things that might be coming in, but in terms of, you know, the answer for that, if you will, is how do we talk about prioritizing our health, right? And I think our sexual health, first of all, belongs in that category of how do we start prioritizing ourselves, right? And that it's not selfish and that it's not, okay, well, we have to come last because we have kids and we have this and we have work and we have, you know, the laundry list of to do things like never ends, right?
Mm-hmm.
And I can appreciate that everything takes time, but at the same time, how do we put the emphasis on feeling good, right? And that feeling good doesn't have to mean you're in the perfect body, right? Far from it. It's just more about how do you feel in this body? And it is a new body, right? As I was talking about before, you know, your 20s was a different body than your 30s. Your 30s is going to be a different body than your 40s and your 40s and your 50s and your 60s and your 70s and 80s and beyond, right? And at each point, we kind of have to look at it and go, okay, well, how do I reconfigure this, right? How do I learn what my new body entails? Who is this new body? How do I take care of this new body, right? How do I accept this new body? How do I love this new body, right? And that's a piece of it. And the piece of the couple together is, okay, how do I accept my partner's new body? Right? How do I
That's
love my partner's new body? Right? And also, how do we love the new bodies without it triggering the sense of dread? Right? And I'm talking about existential dread, right? Because I think a lot of people nearing their, you know, midlife and then beyond, there is now the fear of our health declining, our health, you know, deteriorating. What are we going to do? What's going to happen? And I think, especially in couples, it actually gets triggered even more, right? It gets triggered of, oh, you're suddenly, maybe you've gained a little bit of weight, or maybe you're not looking after your diet, or maybe you're not doing X, Y, Z. And we go, oh my God, I'm really scared right now, because does it mean you don't care about your health? Does it mean that you're not going to live long? Right? What if I lose you? What if this, era is kind of over, right? And I don't mean to bring out the doom and the gloom here, but it's more about understanding the triggers in the couple, right? And then understanding that maybe the criticism that you're receiving from your partner of going, oh, hey, why are you eating whatever it is? It's coming from a place of maybe fear, maybe love, right? Maybe saying, okay, well, how do we change the script so that we're not criticizing each other, but that we actually understand where each of us is coming from? And how do we prioritize our health together in a way that makes sense for us, in a way that doesn't feel, criticizing, or feel like we don't accept each other, or that we don't love each of us in this new physique. And so, how do we change that with time? Right?
Mhm. Mhm.
And then, how does
So,
that have an impact on our sexual health and our sexuality?
so first of all, you obviously get a taste and feeling about the relationship of this couple and the issues and their concerns. So you're hearing them, and then what's the approach? How do you advise, or what's the therapy? If you tell us a little bit about it.
Yeah. So, what I'm going to say though is I'm going to caution that one size does not fit all,
Mhm.
right? And that's actually the most important part, is making sure that it's custom for every single person that walks into my office,
It's same.
right?
It's the same
And that
for any
means that I have to
treatment,
get
I
to know
think.
you. 100%. And that
Mhm.
means I have to get to know you. We have to understand, what are those factors that each of you are coming in with? What does your dynamic look like as a couple? Right. And then once we've done that, once we've established that, once we've established the patterns, once we understand a little bit about what's going on, then we can start therapy in terms of, understanding how to intervene on each of those fronts, right? And again, it's not one size fits all, and it's also not, right away instantaneous, because if you think about it, especially once you've hit your midlife, mid 40s, 50s, 60s, etc., um, usually, typically, unless it's a brand new relationship, right? Your
Mhm.
relationship has gone through the ringer too. It's gone through the ups and the downs. It's gone through pattern. You've accumulated things over the years, right? And so we're not going to untangle all of that within 2 minutes. But I do think that we are able to do tremendous work together in terms of unpacking everything that's happened, maybe processing the little hurts that have led to resentment, maybe to understanding, okay, well, why is this a priority to you? And it's not a priority to me, right? Or how do I understand, how do I make it more of a priority to me, and you make something else a priority for me, right? In terms of how do we make compromises together? How do we, resolve any of our problems that we are having? How do we not have the same arguments over and over again? How are we changing the script? And that's why people come to therapy. It's really to change that script together.
Mhm. Because I think in many cases, when they get to the point that they come and see you or see me, it's probably has gone through for a long time. So it's probably quite a complex and challenging, and it doesn't, as you mentioned, takes just 2 minutes, or it's not magic. It takes a miracle. It takes a while
Mm-hmm. Well,
to.
and yeah, and that's why we have to normalize coming sooner, right? So,
Mhm.
not to come when you're on the
Yeah.
brink of separation and it's your last resort. That's, it might help in terms of, it might create a bond, but that's not when it's going to help the most, right? It's going to help the
Mhm.
most when you're doing general upkeep, because again, I think the myth is that, oh, relationships should be easy. It should be instantaneous, and you fall in love and it's happily ever after and everything should go smoothly at all times. And that's far from the truth, right? The truth is that, like else in life, like your career, like parenting, like, you know, everything, right? You have to work hard for. And the same thing, you have to put in the effort in your relationship. You have to work on your relationship. And without putting in that work together, right, then it's not going to be smooth sailing ahead, right? So, I think it's about normalizing that we need to do more daily checkups. We need to do checkups in terms of coming in for therapy more regularly and at the beginning of the relationship or even in the middle of the relationship, not as a last ditch effort at the very end, right? I tell my clients all the time, I'm like, you take your car in to change the tires every 6 months. You take your car in to change the oil, to do an oil change. You always are upkeeping your car, right? Why are we not doing the same with our relationships?
Yeah. And it is, I believe it's a multidisciplinary, it's a teamwork. So we have to, I mean, I deal with one part, which is physical part, replacing hormones, especially if we talk about the midlife, so helping with the physical aspect. But then still, sometimes we see that it's on its own, it's not working. So then we need the therapy or all together. It works beautiful.
100% collaborative care, I think, is the way of the
Yeah.
future. I think that's what is sorely needed
Mhm.
right now in terms of sexual health, in terms of relationship health. That's actually why we're opening our new clinic in terms of that's the whole raison d'etre is to have collaborative care, is to say, you shouldn't just be seeing, for example, the doctor in terms of, yes, the doctor, 1,000%, you can be helping with the physical symptoms, you can be doing the physical health, but that's not necessarily enough, right? And each one of us, whether it's doctors, psychologists, dietitians, physio, etc., right? We all bring in a different angle and we're all going to help at the same time, but in a different way. And I think that's crucial because, like you were saying, you're like, well, I can do the physical piece. And I'm sitting here and going, oh, I'm not touching the physical piece. I really don't. I don't look, I don't touch, right? But I talk about it. And I'm here to talk about it at length and deeply, right? And I think that's the piece that a lot of the times we're missing out on is that actual, human connection, having a deep connection, someone to actually say, okay, let's figure out what's going on here underneath everything. It's not a band-aid solution. It's
Mhm.
not a one size fits all. It's really processing what's happening.
Yes, absolutely. And you, briefly, I know that you deal and treat cancer survivors.
Mhm.
So I would love to hear a little bit about your work on that part.
Yeah, and I think that's such important work, honestly, in terms of, I think cancer survivors come with a different concoction, if you will, in terms of their baggage, in terms of coming into it, in terms of their sexual health, in terms of their relationship health. It's coming from a different angle, right? And I think, um, a lot of the times the treatment is super focused on surviving the cancer, which 1,000% you need to be able to survive, right? That's the most important thing in that moment. But the part that we often forget about is the survival, right? Is actually having survived and going, okay, but now what? Right? Because now, if I've survived breast cancer or ovarian cancer, any cancers that have really impacted your hormones and your health in terms of that, then you're left maybe with no vaginal lubrication. You're dry down there. You're going into menopause instantaneously without having gone through perimenopause, which is, a slower take on it and giving you the time and the space and the ability to actually say, okay, how am I changing? What am I looking like in the mirror? What's going on here? Whereas this is more abrupt, right? And for anyone who's done, for example, chemo or who's had surgery, right, that's even more abrupt and more changes that are life-changing changes, right? If you're having, for example, your breast removed or something like that, that really has an impact on your body image, right? And so, in terms of the individual factors, there's a lot at play there as well, in terms of how does this impact how you see yourself, how you feel about yourself, how you feel about your body, right? Did your body betray you? Do you feel, angry at God if God is what you believe in, right? How does that impact your overall well being in terms of an individual? And then we haven't even touched the couple,
Mm-hmm.
right? In terms of oftentimes, you know, um, all the help is focused on the individual, and well, it should, right? However, how do we talk about the couple, right? In terms of the partner who's witnessed all of this, who might have had his or her own traumas dealing with their partner going through cancer, right?
Mm-hmm.
The mental load that it takes of caregiving for someone who's gone through cancer. And then in terms of the sexual piece, right? How do you go from caregiving to now going back to a sexual relationship if it's even allowed, right? In terms of medically, are we allowed to at that point? How do we have intimacy? How do we have connection when we're not allowed to have physical sex? Right? Do we lose that connection? How do we feel about each other? How do we feel about facing mortality if it's to that point? Right? There's so many factors at play, and the partners usually get lost and the couple gets lost, right? And so that's where my work comes in terms of, that's the piece where I hope cancer survivors feel comfortable coming to Anna and Solomon for treatment, in terms of treating them both at the same time as a couple and hearing both of them and understanding what each of their experiences have been, and then how do we find the connection again.
Mm-hmm. Amazing. It is very challenging, difficult, but as you mentioned, it's not just the person who's dealing and going through, but the partner as well.
Mm-hmm.
Mm-hmm.
100%, right? And that's not even dealing with if there were, if the couple, for example, went through this at a younger age, right? And they haven't started a family yet, or they have a very young family, or they wanted more, right? If they wanted more kids, how does that impact fertility? How does it impact their conversation, their life goals, right? Their entire, future, right? How does it impact that? And so, there's a lot that we can help with when it comes to cancer and your relationship or sexual health.
That's great. What just before we end our talk today, amazing talk. I would love to hear if you have any recommendations on any literature or books that people can read before coming to see you, or in general. And
Yeah,
also
actually,
any
I know
general
you can all
tips.
see.
Any general tips.
There's a lot of books. There's a lot of great books. Actually, right behind me, I'll kind of zoom in
Mm,
on it. Can you guys see? But there's Reclaiming Your Sexual Self, which is a great book in terms of understanding how to reclaim your desire as a woman. Um, Come As You Are is great in terms of understanding female sexuality, understanding what's going on. Come Together, also by Emily Nagoski. That's a book, again, about couples coming together in terms of understanding both of your sexual desires and understanding where you're at. The same topic, the book Desire by Lauren Vogel Mercy, I believe, is an excellent read in terms of mismatched desire. I also want to point out, if you can see the toy, the Onat, which is
yes.
a great toy
Uh-huh.
for anyone who's experiencing sexual pain upon penetration. That's an amazing toy to have, in terms of, you put it on the penis, basically it's a ring, it creates a barrier so that there is no pain,
Mm.
but you still have that intimacy, you still have the connection, you still have the physical act. And I think that's really great. And there's so many other things I can recommend. You can actually take a look at our website, so
Mhm.
annasolomon.com, and I've actually put together an entire library of resources on all of these
Great.
subjects that we touch on. And so all the books are there, all the products are there as well, that I highly recommend.
Amazing. We certainly go and check.
Perfect.
Arielle, it was lovely meeting you, and hopefully we meet in person sometime. And yes, hopefully we can collaborate and work together.
I would love that anytime. And
Yes,
you're always
yes.
welcome at our new office too.
Absolutely. We'll see you hopefully soon. Have a lovely weekend, and thanks everyone for being here with us. And if you have any questions, you can go check Instagram Dr. Arielle, and hopefully if you have any questions, you can always approach her directly.
Yes, please do.
Great. Have a lovely day. See you soon, and you will still see hopefully this video I'm going to record and leave it on my YouTube and share it with you if you want to share with your audience.
Perfect. Sounds good. Thank
Take
you.
care. Bye bye, everyone.
Bye.
Bye.